Hi, this is Msonda Kasonde, your friend and partner in health issues from Living Hope Clinic, Zambia. Today we have a very interesting topic to discuss, which is common among our male counterparts. It's becoming so common probably because of our diet and our lifestyle. We'll discuss that later. But I won't take it for granted that you know where this prostate gland is. I will give you a basic anatomy and physiology, meaning where it is located and what its function is. It's located right in between the bladder and the penis, right in front of the rectum. I want you to have that kind of picture in your head as we start talking about it, because this same gland is surrounded by a lot of organs that are affected when it has got some diseases, or if it is enlarged, or if it is inflamed. Okay, so in the middle it has the urethra. That is a tube that collects urine from the bladder through to the penis out of your body. So it has this urethra also passing in the center of it. And when it is affected, it means even this tube that is supposed to collect urine from your bladder until it's out may be affected, and you may be failing to pass urine. In that it's right also at the posterior end of this urethra. You know, the urethra runs from the bladder through to the penis. And so this organ called the prostate gland is located just in the posterior end of the prostate, of the bladder. So if it is affected again, it may block the urine flow and you may not be able to pass urine. You may have some difficulties. So I want now to just tell you a bit of physiology, meaning the function of this organ. This organ called the prostate gland, it's an organ that produces a certain fluid. It secretes a fluid. That fluid is very key for the sperm cells. It nourishes and protects the sperm cell from injuries. So if it's not able to produce that fluid, it means even your sperm cells may have a problem. You may have a low sperm count, or you may have deformed sperm cells that will not be able to penetrate an egg or even swim, so that it's able to cause fertilization and the woman will be able to conceive. Then this same fluid that is produced in this organ, it also adds up to the semen. During ejaculation, when a man reaches orgasm, this fluid that is produced in the prostate gland adds up to the seminal fluid, so that you are able to ejaculate after the sexual intercourse. In this prostate gland, it's got muscles. These muscles also helps to propel the seminal fluid when it's about to be released. So if it is hardened, or if it is inflamed, or if it is enlarged, it means the muscles will not be able to propel the seminal fluid, so that this man can be able to ejaculate and have a satisfactory sexual intercourse. So it's a very, very important organ. That's why I want you to have a picture on the organs that surrounds it, because the moment it's deformed, the moment it is diseased, it means all these organs that are around it will be affected and they will be dysfunctional. And so you will go to the clinic and you will present certain symptoms related to this prostate. So I just want to mention the organs that are exactly surrounding this prostate organ, so that when you see that you're having a problem pertaining to any of the organs that I'm going to mention, then you should know that before you get into any complications, you should rush to your nearest health center, your nearest clinic, your nearest hospital, so that you are checked thoroughly and attended to as quickly as possible. The quicker we manage a mild condition, the better and the cheaper it is. So this organ is surrounded by, one of them is the bladder. The other one, it's the rectum. The other one, it's the penis, and the urethra that passes in the center of this prostate gland. So if this prostate gland has any of the common diseases that affects it, like the same prostatic hyperplasia or prostate enlargement, then it means the bladder or the rectum or the penis or the urethra that passes in the center of it may be affected. Then it also has the other common disease or deformity that can happen to the prostate gland is calcification. After it has enlarged, it may calcify. Calcification simply means hardening like a stone. And I told you that this prostate gland also helps to propel the seminal fluid so that somebody can be able to ejaculate. Now, if it is calcified, it means those cells or those muscles of the prostate gland will not be able to contract and relax because they are hard. It's like they are dry. And then other times it may have issues of prostatitis, meaning inflammation of the prostate gland. So these are some of the common forms of disease that you may be able to find in the prostate gland. So for today, we'll end here and we'll continue the next health tip. Kindly just keep on following. If you are within Zambia, you are within Lusaka, you want to visit our clinic, the lines, I'm sure they are scrolling on the screen, and you'll be able to pick those lines. Give us a call. We will tell you how to go about it. So for now, goodbye.